Joining me here live now is the Shadow Health Minister, Chris Bowen. Mr Bowen, thanks very much for your time. Do you welcome the government's latest restrictions on travel, the South Korea ban, and also those other restrictions as they pertain to visitors from Italy?
I do, and of course they're based on the latest advice from the combined Chief Medical Officers, Commonwealth and State. It's a big step, as all the steps are here. And really, as the government has said, and I agree with them, this is about slowing the spread of the virus in Australia. Nobody should pretend that this can be stopped completely, but it is appropriate to try and slow it to give the health system time to prepare. I understand it will be of some disappointment to people in the affected nations, particularly Korea, but we must ensure that all the necessary checks and balances are put in place, and I think this is a sensible balance.
Should some of those restrictions have been done earlier, given the trends here?
I think, again, I mean, there are some things I'll criticise the government about on many matters, and including some criticisms I'll make of handling of this, but I'm only going to make them where I think they're very valid and genuine, and they're working on the best advice available to them. The institution is working. I mean, the joint committee of the Commonwealth and State Chief Medical Officers, Chief Health Officers at the state level, is providing daily advice to the government, regular briefings to me and the opposition, and they are acting on that advice, as any government would and should, as a Labor government would, as I would as Health Minister. So I'm not critical of that. I think these are big decisions and they're taken in the appropriate way.
And you've been receiving some of these briefings as well from medical,
absolutely,
the Chief Medical Officer and others. Where does this end up? Well, what's your expectation? Are we talking about hundreds of Australians, thousands, tens of thousands to be affected here?
Well, look, it is a very, very serious challenge. Now, as we know, the majority of people who get this, the vast majority of people who get it, will get it very mildly. 80% of people will get it so mild that they may not even know they have it. They certainly should not go to work or school because they're still infectious, and that's one of the challenges. Unlike, say, SARS, where people, by and large, knew they had it because it was a very severe condition, with this condition, 80% of people get it quite mildly, and they might just feel a little bit sniffly, a little bit sore, a little bit unwell. And then they go about their business, but they're still quite infectious. 15% of people will get it relatively bad, and 5% will get it to such a degree that they need intensive care. They're very critical. So that's not to say that this isn't very serious, and it can, of course, the challenge is it can spread very, very quick. Look at Italy. There was a handful of cases a week ago. Now there's hundreds and hundreds of cases. So it can spread very quickly, and or people can have it and not know about it. So probably in Italy a couple of weeks ago, the numbers were there, but people didn't realise they had it. It can spread very quickly. The modelling shows that a substantial proportion of the community can and will be affected. But we do need to keep this in context at all stages. It's very serious, but we have to act on the best medical advice.
Have you got any sense of where the research is at for a vaccine?
Yes. The research is coming along well, but with the best will in the world, we are months and months away from a vaccine because, as you'd imagine, Kieran, it has to be tested, human trials, clinical trials. No health authority in the world is going to sign off a vaccine unless they're sure it's safe, that it works. And Australia is playing a valuable role there, our world-class medical researchers, but people shouldn't assume that a vaccine is any sort of quick fix.
A couple of concerns that have been raised. I know that there's largely bipartisanship in this area, but 2GB reported earlier in the day that a heavily pregnant employee was exposed to patients at the Sydney nursing home. That she had arrived, was exposed to the patient, saw emergency staff dressed accordingly and asked what was going on, but she wasn't told. This is a woman who's 36 weeks pregnant. Well, that's quite a worry.
So one of the concerns I expressed this morning is in relation to aged care and what appears to be the argument, the bickering between the New South Wales government and the federal government, and that's not good enough. I mean, we are providing bipartisan support, but it's not a blank cheque. We're providing constructive engagement with the government, and where you've got that, that sort of concern being expressed by the New South Wales Minister, the federal government, the Federal Minister for Ageing needs to deal with that as a matter of extreme urgency. And now, look, I've had other reports which I've dealt with constructively about various incidents around the country. I'm not going to comment on a specific matter. I haven't received full briefing from the CMO and the health authorities about the matter you've referred to there that's been reported, so it would be irresponsible for me to comment one way or another. Obviously, if that report is correct, it's deeply concerning, but it would be appropriate to get full briefing on it first.
What about the WA issue around the Rockingham Hospital in the south of Perth? Apparently, according to the West Australian, people visiting the hospital with concerns that they might have the virus were directed to a car park.
Well, I saw that
outdoor car park. Is that accurate?
Well, I saw the report in the West Australian this morning. I saw the pictures. Now, it's not clear to me the pictures of people in the car park as to how they got there. Again, it's appropriate. I spoke to Madeleine King, a Western Australian MP, about this today. She, obviously is looking into the matter and talking to the Western Australian government about that. Again, there'll be different measures put in place. One of the issues in Western Australia has been GPs saying don't come to our clinic. Now, I stress here, Kieran, I think the most important thing for the government to do is to interact very closely with the Royal College of General Practice, with the AMA, to ensure that doctors are getting every support they need in this issue. Now, I've spoken to doctors who say, yes, we are getting the support. I've spoken to others who say they aren't. And I accept that this is a complex arrangement and will take time to get 100% right. And when I do get that feedback, I pass it on to the government for constructive work to fix it.
You've obviously been very measured in terms of the language around this virus and putting the threat in context. Would you urge calm to Australians? Because we've seen a lot of panic buying around the country.
Yeah, well, I'd urge appropriate precautions be put in place, not panic buying. Not panic buying. We have a shortage of masks around the world, for example. So we have to be careful about how we use our masks, and they've got to go to those who are most need them the most to start with. It's a matter for people whether they buy toilet paper or not. It's a free world, but I don't think panic buying is the right answer to the challenge facing us here.
Labor has been targeting the Prime Minister on various issues, trying to target his character, but also on sports rorts and those sorts of things. Do you think that Australians want the Labor Party and politicians generally to move on and to be focusing on issues like coronavirus, given it is such a major concern?
This building is capable of doing many things. Yes, we're engaging constructively with the government. That's our job. That's my job as the alternative minister. Not a blank cheque. Doesn't mean, everything the government does gets approval from me if I'm not convinced. But it does mean we engaged very constructively with them. But we're also not going to give the government free pass on things that are going wrong. Sports rorts is a scandal. And you talk about the Prime Minister's character, just on coronavirus for a moment. We just had a very constructive conversation. We've had them with the government. The Prime Minister just lied about the Leader of the Opposition on coronavirus. Just said the Leader of the Opposition refused a briefing from the Chief Medical Officer in Parliament. It's a lie. The Leader of the Opposition just ran through it all in Parliament. There was a mix-up in the Chief Medical Officer's diary. He turned up for a briefing. I took the briefing instead. It was never intended that the Leader of the Opposition be there. We've had 2 now briefings from the Chief Medical Officer, direct to the Leader of the Opposition. I've had multiple, which I appreciate. But for the Prime Minister to try and politicise it and tell a lie about the Leader of the Opposition goes to his character, just as it goes to his character that he's not telling the truth about the Chief of the Defence Force. Yesterday we asked him, did the Chief of the Defence Force complain about the bushfire ad? He said, I just talk to the Chief of the Defence Force all the time. Today he said, I admitted that he had spoken to me, which he didn't do. Just tell the truth. It took him how many months to tell the truth about Brian Houston? Why doesn't this guy just tell the truth as the first response? He gets dragged there all the time, and it's not good enough.
As someone who's watched the economy very closely over many years now, is this coronavirus the sort of threat to the economy that will see a recession?
It'll have a negative impact. But we went into this issue with a weakening economy. That's the key point. The government would say everything was rosy until the bushfires and the coronavirus. Just not true. The economy was tanking beforehand. Of course, nobody would argue, Jim Chalmers isn't arguing, that the coronavirus isn't a negative impact. But it's not the main issue. The main issue is that the economy was already tanking, and this comes on top of it. So, of course, it's negative, but it comes on top of weakness. And the government's got no answer. We keep being told, there's something coming. We went to the election promising an investment guarantee, an upfront deduction for investment, to encourage businesses to invest. Businesses are crying out for that sort of thing.
It sounds like that's where the government's going to land.
Well,
so you'd welcome that.
They poo-hooed it at the election, didn't they? You would have interviewed Josh Frydenberg saying, no, that's nonsense. Well, he may well do it now, and so he should do it. But we called for that. We went to the election promising it. This government's like a kangaroo in the headlights, doesn't know what to do in the face of weakening investment, no plan for wages growth. The Reserve Bank just this week said wages growth isn't going to be picking up anytime soon. Scott Morrison's been promising wages growth for years as Treasurer and then Prime Minister, saying it's about to happen, it's about to happen, it's about to happen. Well, it's not happening.
Okay, Mr. Bowen, I appreciate your time.
Great pleasure, Kieran.
Thanks.